Welcome, and thanks for joining us today. Hi, everyone. My name is Audra Walters, and I'm the CDC Project Director here at Shape America. Thanks so much for being here. We know there's a lot of choices today. I think there's like over 100 sessions every day to choose from on the schedule. So thank you so much for being here with us live. And one of my favorite things about Shape Virtual is that now you don't actually have to choose between all the sessions. Since this Lunch and Learn and others are going to be recorded, you can actually see the sessions that you wouldn't normally get the chance to see. So just give the recordings about 48 hours to get uploaded, and you'll have 45 days after the convention to watch them. So I'm really excited to get the opportunity to talk with Dr. Sarah Lee of the Centers for Disease Control and Prevention's Healthy Schools team and Elizabeth Clark of the National Association of School Nurses. So just for reference, because I'm sure I will accidentally start using acronyms, CDC and NASN. Both have been very much on the front lines of providing guidance to schools during this past year. So today we're going to talk about what that was like to work on that guidance, the implications for schools, and particularly physical activity and physical education in particular, and valuable resources that are available to support schools and communities in their decision-making through the rest of the school year, because we're still in the school year, through the summer and into planning for fall reentry. To get us started, though, I'm going to let each of them introduce themselves and tell you a little bit about the work that they do at the CDC and at NASN. So, Sarah, I'm going to turn it over to you first.
Great. Thank you so much, Audra, and thanks to Shape America for this session and for inviting me to be involved in it alongside Liz from NASN. This is really exciting, and I look forward to all that we're going to discuss and share. So a little bit about my background. As Audra said, I'm at CDC. Within CDC, I am in the National Center for Chronic Disease Prevention and Health Promotion within Division of Population Health, which is where the Healthy Schools program sits. And I serve as a team lead for research application and evaluation. And so our team does a lot of work related to data collection, surveillance systems, evaluation, writing guidelines and recommendations related to our core priorities of physical activity, school nutrition, health services, and healthy out of school time. And we do that within the context of the WISC model, or the whole school, whole community, whole child model. So a very comprehensive approach is what we use and work with partners to use to implement strategies and activities that focus on those core priorities. As you can imagine, over the last year, that has shifted a lot. And so much of what our Healthy Schools program has been doing is supporting CDC's COVID-19 emergency response. For me personally, I have been quite involved over the last year doing multiple deployments, helping write and disseminate and train on the guidance for schools to address COVID-19, as well as other community-based settings like childcare centers, summer camps, colleges, and universities. And we have been able to really use the work back in my day job in my home office to be a voice of schools and of teachers and of school nurses and others within the school community as we craft the guidance that has been going out throughout the pandemic. So that's it for me, and I'll turn it to Liz.
All right. Hello, everyone. I am Liz Clark from the National Association of School Nurses. And if you're not familiar with NASN, NASN is the only professional organization for school nurses. We're a nonprofit, a 503c, and our vision is that all students are healthy, safe, and ready to learn. Next slide, please. There I am. I've been with NASN a little over a year. I have 25 years of school nursing experience in the lovely state of Colorado as a school nurse and school nurse administrator. I also administrated a school Medicaid program. And this past year, I have been the project lead for the COVID work that NASN has been doing, and has worked closely on many CDC task force to support the work that CDC is also doing to address schools and school health. Next slide. And I just want to share briefly that because, school nurses are healthcare providers in schools, we started, as soon as we heard about the concerns with COVID in February of last year, developing resources for schools and school nurses. And so at this point in time, NASN has developed over 30 resources that schools and school nurses can use. We have professional documents, professional development. We've done various webinars that are recorded and on the website, and podcasts. There's videos that we've produced, and as well as several interactive tools. And two of those interactive tools are actually for parents or caregivers that can be used to better understand COVID, frequently asked questions, as well as information on, whether or not their child should return to school. And so on this slide, you can see there are linked the NASN homepage, and also the second link is for the specific COVID resources that you can check out.
Awesome. Thank you so much, Liz. Again, thank you both for being here. Before we jump into questions, one of the things the three of us were talking about right before we went live was how this past year has really just proven how fortunate we are to have organizations like the CDC and NASN to muddle through this past year and provide science-based guidance and resources for schools as we're all trying to make decisions we never really thought we'd have to try to make. So I'm excited that we're going to get the chance to talk with them. So feel free to put your questions in the chat, and I have some questions that I'm going to be asking them, but I'll be monitoring the chat throughout. So put them on in there. Keep in mind when you're asking your questions that Sarah and Liz can speak to national guidance that their organizations provide, but they likely will not be able to answer any questions that are specific to your local community or district necessarily. So when in doubt, go ahead and put it in the chat. But yeah, just keep in mind that they're talking about kind of that national guidance. So first, I'm going to start with Sarah. Could you share with us some key takeaways or updates from the fairly recent updated operational strategy guidance for K-12 schools?
Sure, I'd be happy to. Before I dive into some of the details about the operational strategy, Audra, I think one of the things that is so important to share about guidance that we've developed, and generally how CDC develops guidance, but I'm going to really focus on how we do that in a pandemic and with such a large emergency response, is we consistently rely on the science. And you mentioned that, the science and the evidence base. And because of that, obviously we have learned, every day almost, we learn more and more about COVID-19. And so what that means is the more we learn, the more we are able to update and refine the guidance itself. And so while we're speaking about the K-12 setting today, I thought I would mention that the first set of guidance for folks who were not aware was, I shouldn't say well over a year ago. It was just over a year ago when we released guidance for the school setting. And we were very focused on what we knew at that time. It wasn't, but I think 6 weeks later that we updated that guidance as we had learned a lot more about things such as mask wearing and what physical distance recommendations, cleaning and disinfection, those types of strategies. And that was released last May. We have since updated and refined the guidance a couple more times. And so Audra mentioned the operational strategy for K-12 schools. This document was actually first released in about mid-February. And then because there was a lot of additional science coming, particularly in the areas of physical distancing and the cleaning and disinfection, there was another update that was released at this point, I guess, just over 3 weeks ago it was. And so what I thought I would share is just some of those top level highlights. The way that the operational strategy is framed is really as this integrated set of tools and resources to inform decision-making about opening schools. Because we know at that point, even halfway through the school year, there were still a number of schools or, entire districts who had not opened their doors for in-person learning, or some were, in a hybrid. And so this operational strategy was really meant to help inform that decision-making that was data-driven and based on the best available science. So what are the key takeaways from the guidance? The first is, like, time and time again, we've said this, and I think we just really hone in on it on the operational strategy, is that layering these prevention strategies, or you've also probably heard them called mitigation strategies, is really important. And that what that does is give that layers of protection effect. So the more that we have these layers in place, the more we're protecting the school community from transmitting SARS-CoV-2, the virus that causes COVID-19. Specifically, I've already mentioned some of these: consistent and correct mask wearing among all people who are, fully able to do so throughout the school day, physical distancing, cleaning and disinfection. And then it goes into more details about maintaining healthy facilities and operations. Ventilation is included in that. And then we also talk specifically about the role of vaccination, because, of course, now the vaccine being available, which it wasn't as widely available for the K-12 setting with teachers and staff when the original operational strategy was released in February. So we talk about that as another layer of those prevention strategies, as well as testing programs for schools that choose to do so. So the document really hones in on that layering approach of those strategies. What I will share is that physical distancing component was updated from 6 feet for the most part. There's little, nuances here and there, to 3 feet. So why did we do that? Well, there was a growing body of evidence where there were some really wonderful, well-done studies that made observations and had reports very consistently about the distance between kids, particularly in a classroom, and not distance between desks, but between the children themselves, as well as looking at and observing, as well as reported behaviors among teachers and staff. And so we moved based on the evidence to see that in most cases, particularly across elementary school, we do recommend the 3 feet across community levels of transmission. For the most part, we recommend that in middle and high schools as well. And that changes a little bit if you have higher rates of community transmission, where we strongly recommend cohorting. And if cohorting is not possible in that middle and high school level, to increase back to that 6 feet. So I wanted to highlight that those were some of the main changes that came out when this was updated and released again just a few weeks ago.
Awesome. Thank you. And I appreciate that you talk about layering the mitigation strategies. And yes, I know we all want to know everything right now, but that's the thing that you mentioned with looking at data and making data and science-driven decisions. We need to know some things before we can say provide more guidance. And I also like that you talked about layering mitigation strategies, because that's kind of how back in the summer when Shape America released their resources for reentry around guidance for physical education, physical activity and health education, we wanted to make sure that the CDC guidance came out first, and that we did kind of that more specific layer related to PE, health, and physical activity in schools. But we wanted to make sure that it was a layer or a deeper dive within that guidance provided by CDC. So thank you for that.
Yeah, and can I add one more thing? Yep. First off, super excited that SHAPE did that, because that really helped dive deeper into providing guidance for health and physical education teachers that was not in the CDC guidance, because remember, that's a whole of school approach looking at multiple aspects. And one of the things that I should have stressed is that the two most if we often get a question, what are the top strategies? Okay, so you're telling us to layer them, like, which ones do you prioritize? Even though we keep saying, keep layering, keep using all of them. But when you look at the evidence, mask wearing, again, that consistent, correct mask wearing and the physical distancing are really the top key prevention or mitigation strategies that we recommend must be in place in order to reduce transmission.
Awesome. Thank you. I'm going to switch up the order of questions a little bit. And so, Liz, I'm going to ask you, would you mind speaking a little bit about the role of school nurses during COVID, both this school year and kind of thinking forward to the next school year? And then any feedback or tips you have on how health and PE teachers can collaborate and support their school nurse?
Sure, absolutely. Happy to do that. School nurses are collaborators with health and PE teachers, and many issues for students in general, as well as students with chronic health conditions, are identified every school year. So, for those health educators, school nurses can provide trainings and resources for you. Trainings such as hand washing, respiratory etiquette, covering those coughs and sneezes that we've done for years, proper removal and storage of face coverings during the school day. Many schools have come up with different plans on, where they're storing those during lunch or during recess, and proper removal of other things within the classroom, that our children are accessing, art supplies and those sort of things. So, I think it's also important that school nurses provide resources for those hygiene, classroom instruction, and also the pathophysiology of COVID-19. School nurses can come in and do some health education and support the work that you're doing. And they can also connect with community resources. So having a speaker come in, such as a physician or someone in the healthcare world in the community that's going to speak on a specific topic, school nurses often are great resources for that as well. And the other thing that we need to think about is because students exert themselves in PE, there's also additional trainings that are needed for students. And we also train our PE teachers to identify students that are at risk with chronic health conditions, such as diabetes or asthma, what sort of things to look for, how to identify they're having issues, what sort of emergency care to provide. And there's been lots of questions this year, and even in regards to asthma. One of the things I also wanted to share is that many parents are concerned about their child with asthma wearing a mask, right? Is it safe for my child to wear a mask? Is that something that's okay? I know many providers in the community, healthcare providers, have had parents contacting them asking these questions as students return. And it is safe. Students with asthma can wear a mask and should wear a mask during the day. And so that's very important. The other thing that I would add is that, school nurses do develop individual healthcare plans for students and health action plans for our students with chronic disease, and often work very closely with PE teachers in implementation of those plans, education, and, how to keep an eye on those students that need that support. So, PE teachers and health teachers can consult with school nurses and support those plan implementations. So, in supporting their school nurse, I would recommend that health and PE teachers, check in with their school nurses, encouraging them and other staff to provide safe care and increase their physical activity. And I think this is really important. So, we're all working together in this. And as Sarah said, things are changing, and, we need to make sure that we're on top of the latest guidance and we're able to implement that into the school. So, school nurses have been busy. School nurses have had additional tasks added to them this year, contact tracing and, testing. Many schools are doing testing in schools, and school nurses are involved in that. And so it's really been a lot on top of the role that they normally do. And so, having those support from other staff is really critical in making it through this time, and knowing that, vaccines are on the horizon for students. And my guess is that school nurses will also be involved in that aspect in the future. So I hope that answers your question.
Absolutely. Thank you. And it was actually a really good teaser of a resource that I'd not forgotten about, but hadn't really thought about in the context of this session. And you talked about understanding managing students with chronic conditions in physical education settings. And so we actually, Shape America actually worked on a resource with NASN back. We started working on it pre-COVID, but it's actually a poster series. And I'm going to put that in the chat box, the link to that. But there's kind of a orientation 2-pager, and then it's a series of 4 posters on specific things for 4 of the highest incidents for chronic conditions for students, particularly related to exercise-induced, something that might happen in physical education class. So just considerations for PE teachers to have. So that was actually a perfect little teaser for that resource. And I'm going to open this to both of you. I feel like we've kind of touched on this, but what are some more specific implications of some of the things that we know now after a year of providing guidance and doing research for physical education and physical activities in schools, specifically looking for and planning for the fall's reentry? And this is open to both of you, either one of you.
Sure. So I think that early on, as schools, tried to go back in person and were thinking about how that would look, some of the concerns we heard, and I know Audra, you and others at Shape America heard this about, can we actually have physical education and recess and classroom activity and do it safely? Or is it going to increase our risk? Is it a higher risk activity? And so, again, the good news is we've learned more and more, and we know, especially with masking and distancing, those activities can and should continue. We all know that this pandemic has certainly taken a toll on mental health of all in the school community, including the students. And physical activity opportunities remain that much more important in our schools and for our students. And we all still have students in a virtual space as well. And so major hats off and kudos to teachers who have been juggling, and especially PE teachers who are trying to keep movement going in a virtual space. But I think when we look back and look at the guidance itself, it really, if those consistent layered prevention strategies are put in place, we can safely have physical activities. And I think PE teachers can speak to this much more than I can, but I do not doubt that they have had to be incredibly creative with trying to keep kids distanced, come up with new activities, adapt existing activities that they were implementing, and then thinking about recess in the same way, right? Which we really, as a field, we so push that this is free play and it's a time for, choosing the activity they want to participate in and student driven. And in some cases that might be a bit challenging when we have to intervene on the playground and say, you got to keep your distance, be careful. So I think it does have implications in terms of what we've said in the guidance. And I also just love hearing the stories about how physical education teachers and those who supervise recess and classroom teachers holding classroom activity still have been able to do this successfully and not with high risk, and just be, continuing to give students those opportunities to be active. In fact, I need to send to you, I don't know if I can put it in the chat, but there's a project we have through the COVID response to submit success stories. This is hot off the press. And just for the K-12 sector. And we would love to hear from physical education and health education teachers about how they have adopted and implemented the guidance, as well as, creative ways that they've been able to keep kids active at that moderate and vigorous level in a safe way. So I'll send that. Can I actually submit it in the chat?
Yeah, you could even drop it in the Zoom chat and then I can populate it. Liz, did you have anything that you wanted to add?
Sure. The thing that's most important is that, with the new guidance that's out, is that, PE, typically when your kids are being active, they're exerting themselves, right? And SHAPE has great guidance. And, just to highlight with the new recommendations that because they're exerting themselves, you're going to still maintain that 6-foot distance rather than the 3-foot when they're participating in those activities that you'll have creatively designed. And, being outdoors as much as you can, well ventilated, if there's windows that open in the gymnasium or the roof, some people have, fancy things they can do. And then, as Sarah said already, just reinforcing those mitigation strategies. And if you, have to highlight what you're doing, hand washing before and after PE is great. As we know, kids touch everything and their, face included and their eyes and everything else during activity, and, cleaning equipment on a regular basis, and high touch areas, coming in and out of doors, those sort of things. And that, soap and detergent is now what is recommended in water, rather than expensive cleaning products. So, I think, as Sarah said too, the most important thing is that mask wearing and monitoring that for students and making sure they're properly wearing their mask. It's covering their nose and their mouth, and it fits snugly on their face. And, they're leaving it on, during activities such as physical activity. So, I think those are really the most important things. Just reinforcing that. I know sometimes, as teachers, you feel like you're, sort of policing these things, but that's the most important thing that we can do to reduce the spread right now is making sure those faces are covered with masks and hand washing and continuing those hygiene. So that's my 2 cents.
Thank you for that. And I know early on in the pandemic, when thinking about wearing a mask and everything, I did not realize how much I touched my face until I was aware that I should stop touching my face. And it was all of a sudden, it was like the only thing I wanted to do. So there we go again. It's definitely a good reminder. And keep questions coming in. We're going to definitely get to questions from the chat box. We've got some really good ones I can't wait to get to. But kind of switching a little bit, a question to both of you is talking specifically about kind of how health educators can address concerns about the pandemic, talking about vaccine safety, and things like that. So kind of more specifically from like the health educator standpoint, how can they work to support these mitigation strategies? And you've already kind of addressed this a little bit, Liz, by connecting with the school nurse. But is there anything else either one of you would like to add?
Yeah, I'm happy to start on that one. Educators do have a significant impact on their students and families. And I think it's important to share the why they were vaccinated. I'm hoping that teachers in every state now have had the opportunity to get vaccinated or they're in process of being fully vaccinated. I know that's been, supported by the current administration. So, thinking about staff in schools, health teachers particularly, you can come up with very creative things of how you can showcase that in your school. And it is a confidential thing. So people, have to be voluntary, right? To share that you were vaccinated. But, there's something, you can put something on the school webpage, highlighting maybe a certain teacher, the PE teacher or the health educator. You can also talk about the principal. Everyone loves the principal, showing them getting their shot. You've seen probably lots of pictures in media about nurses and physicians getting shots. Those have been commercials and things that have been out there. And so, the school is really a trusted community. And so I think, it's important that the school staff also showcase that they say, this is important and this is why I did it. And even coming up with ideas as to why it's important to you. I'm a PE teacher and I work with students with special healthcare needs and I want to protect them. Or, I'm a classroom teacher and I love to travel. And so I want to travel this summer. And so I'm getting my vaccines. And so whatever that is, I think that's also an idea to go forward. Making it personal is really important. And I think, that's something that staff can do and health educators can think about creative ways to get that word out. Schools use all sorts of media. There's, newsletters, there's email blasts, there's announcements and things that go out to community and families and caregivers. So, using whatever resources you have, sharing those and highlighting those, I think that will really help to get the word out of the importance of being vaccinated and knowing that others that people trust are getting vaccinated is important.
I don't have much to add to that. This is certainly more, NASN on the ground, as Liz already mentioned, the work that they've already been doing across the country when the initiative launched for the month of March for the K-12, teachers and staff to have access to the vaccine. And as Liz said, the role of the school nurse is so huge in being able to talk about it and reach the school community. I think more broadly, which what I'm about to say are really just, good cross-cutting principles of health education, is to provide, transparent, evidence-based information that is understandable for your teachers, staff, your parents, your students, and that's going to differ across the United States. What the level of understanding is, what the comfort is, and so being able to really tailor communication and health education is going to be very important. It always is, right? As health educators, we need to be doing that. And I think continued collaboration with the school nurse and with others in the community is critical. Working and tapping into that expertise of local and state public health, as well as healthcare providers in the community. We schools bear so much of work that is just amazing. And it's just amazing when you peel back the layers of how many roles schools take on to address the health and academic success of students and the connections that they have. So really, one of my biggest recommendations is rely on some of those partners and tap into them and leverage new partnerships that can help disseminate information that is grounded in science and it is really tailored to your school community.
Absolutely. Can either of you or both of you speak to the impacts of COVID-19 on particularly student and staff health and well-being? And if you have resources you'd like to share specifically around that area, because I know that that's something that was important before, but I think has taken on an entirely new meaning right now. So yeah, if there's anything that you have to share around that.
Liz, I can go ahead and share a little bit of the research that's being done that we're involved with, and then I'll turn it over to you. So just a few weeks ago, we actually released a paper in one of CDC's publications that focused on, it's through what's called the COVID experience survey of parents and their children 5 to 12 years old. Also have a survey for the adolescent population of the 13 and older. But the results that were published more recently looked at both parent and child stress and other indicators of distress throughout the pandemic as they have experienced it. And as many will not be surprised, parents reported a lot around the stress of childcare, of learning at home, of job loss, of financial constraints, of their own anxiety, of, the unknowns, and also reported very similar types of stress among their children. And so that survey is actually going to be repeated this spring and look at and be able to do some comparisons to what the reporting was in the fall and how that may have changed from then until now, basically. And I will put a little plug in because we also asked a question about parents' perceptions of their child's physical activity, which is relevant for all of us. And we analyzed that by learning mode. And that's the other really important finding across actually a lot of those variables I just talked about related to stress and anxiety, is that when we looked at it by virtual, hybrid, and in-person, students who were virtual only had reports of less physical activity compared to the other two, which is really important for us to think about in the education sector. And there were also, they not across every variable, but many of the variables of stress and distress were those worse among parents of kids who were virtual only. And so that is a big finding, right? And that's something we need to be thinking about and continuing to investigate. There are a number of other studies that are looking at just the impact of the pandemic on the mental health of all ages. And it has taken a tremendous toll, as I mentioned earlier. One area where we need more evaluation and research, and maybe if those folks in universities are in this session, we really need to understand the impact that this has had on teachers and staff, because this, and across the board, from classroom to physical education to school nurses, this has been, adding more and more to your plates. And so we are very interested and hope to learn more about the impact that it's had on teacher and staff, mental health and emotional well-being.
Thank you. And Sarah, if you have access right now that you can drop the link to that study, that would be great. If not, you can email me and I can get it into the handout section. Sorry, Liz, go ahead.
Thanks, Sarah, for that. I think, we have seen that, students are behind in academic progress, missing that structure and supports of the school community. And the inequities that were already present in students, particularly our students of Black, Hispanic, American Native, and a specific Islander race and ethnicity, have intensified. And so, COVID-19 has really disproportionately impacted this student population, similar to the adult population. And the pandemic has highlighted those many basic needs that schools have provided, such as nutrition services, daily support and monitoring of chronic health conditions, health education, physical education, as Sarah said, and mental health support. So the social emotional needs of students, is a very serious concern. And it's based on trauma from the pandemic and the many losses that the students have experienced, just the loss of that school support. There is a study that just came out in March from the Center for State and Local Government Excellence. It was a national survey that was conducted in October, released in March of 2021. And it showed that 63% of the K-12 staff felt stressed, 54% are burnt out, and 47% had anxiety at work. So, those are pretty significant statistics. And 38% of K-12 employees reported they're considering changing jobs after working during the COVID-19 pandemic. So for staff, the strain of additional time in developing and implementing virtual instruction in a very short time frame, plus for the school communities that returned to in-person learning, they also had to address changing from virtual to in-person and back and forth. And so, depending on what that instructional application was at the time, the stress associated with feeling exposed at work to the virus, isolation and quarantine requirements, as well as adapting to the additional cleaning, cohorting, and reinforcement of the recommended mitigation strategies was incredible. NASN heard from school nurses across the country that returned to in-person learning that school nurses were working 12 to 16 hours a day, 7 days a week. And that was just to address the day-to-day activities such as COVID testing and contact tracing. And we know that all school staff, has been really working above and beyond during this past school year. So it's really been something we've never experienced before, and will definitely have some long-term impacts that we need to be ready to address in moving forward.
Awesome. Thank you both. And so we've gotten some really good questions from the participants here. So I'm going to take the next several minutes to ask. I'm going to open it up to both of you if you have anything you'd like to share. Although I do think that this first one might be a little bit more for CDC. So we've got a PE teacher that says, right now we are outside, masked, and physically distanced. But can you speak a little bit more about shared equipment, such as basketballs and frisbees within cohorts? If equipment is cleaned between cohorts and kids clean hands before and after PE and recess, can they share equipment? So is there any clarity around that, Sarah?
Great question. Yes, they can. If you're following that protocol, yes, you can absolutely share equipment. And Liz had mentioned, oh gosh, I'm losing track of my weeks, forgive me, but it was I think it was just over a week ago. We did release updated guidance, again, based on more and more accumulation of science around virus survivability, essentially on surfaces. And so that's where this hopefully gives some of you a sigh of relief that yes, you can use the shared equipment. Routine cleaning versus the disinfection, as Liz mentioned, just with soap and water detergent is sufficient in these cases, and that more, the routine cleaning of high touch surfaces, and in many cases for you all, that does include the physical education equipment because you're consistently using them throughout the school day. So hopefully that helps answer that question.
Awesome, thank you. And kind of a similar question that I don't actually know the answer to, but can you talk about equipment in the sun? If equipment is out in the sun, does it need to be cleaned between uses? And I'm assuming that refers to both kind of like playground equipment as well as things like basketballs and frisbee kind of equipment.
So there's so much that would be, it depends because of how long, what's the temperature, but sticking with routine cleaning and not having to have as much concern about the between uses is what we released more recently in terms of cleaning and disinfection guidance. And so still a good idea to clean those frequently used, objects and equipment and high touch surfaces. So that's something to just take into account, especially if you're thinking about a playground. But that's the other thing I can put in the chat, Audra, is the updated guidance, because that will give more details and it does provide a little more level about different scenarios and if this, then that. So hopefully that will help to share.
Oh, amazing. Thank you. And another question for both of you. Does the CDC and or NASN foresee students, especially in elementary, receiving COVID vaccines prior to the fall? And if so, how will the guidance, particularly regarding face covering, physical distancing, will it be the same or different from adults that have received the vaccine?
So I want to make sure I got that correct. Was the first part of the question the anticipated time frame where the next age group of kids will be able to have access to the vaccine?
Yeah, particularly elementary students before the.
Yeah. Oh, so it's the $1 million question. We all want to know. I can't speak to that. And there's a whole vaccine task force within our emergency response that might have a better understanding, but everyone had access to the initial results from Pfizer's trial of the 12 to 15-year-olds. Obviously, that's more upper elementary and middle school, showing, incredible effectiveness in that age group. So when that will become available for that age group, still don't know. Like I said, it is the $1 million question, and I don't know that we can say this is exactly when. The trials for that younger age group are initiated. And so that will, thinking of the ways in which the 12 to 15-year-olds took months of trials, it's very similar, process to my understanding, but I am not a vaccine expert. I'm happy to follow up, though, if I could get any more detail from my vaccine colleagues.
Yeah, I would agree, with Sarah, we keep asking the question and we're not getting a lot of answers yet, other than the clinical trials are, in process. There are states I have heard that are starting to think about administering vaccines to 16 and older, because some states have opened up the vaccines to anyone 16 and older. So if you happen to live in a state where that is occurring, that's something, if there's adequate vaccine, that school could partner with their local health department or another hospital system or other organization, a clinic, federally qualified health center, that could potentially administer vaccines to students that are 16 and older, including, our special needs students, the 18 to 21-year-olds, and that are in transition programs and those sort of things. So that's definitely, I have heard that that conversation is actually happening in many schools, in states that have opened that up. And school is yet, through May or June for most of us. We also have heard to, improve the academic losses that have occurred with the pandemic, that many schools will be looking at enhancing their summer programs. And so there also may be vaccines administered during the summer. after the 16 plus, it'll be that 12 to 16 or 12 to 15 year olds. And so not sure if that'll be summer or early fall, potentially. I mean, we're just sort of guessing at this point. Younger children under the age of 5, because of they have to calculate the dose, because if you have a young child, when you take them to the pediatrician, they weigh them first thing because everything is based on their weight. So they have to calculate the appropriate dosage for those little ones, infants through 5-year-olds. And so we're anticipating that probably will take longer. And so we're looking at maybe into next year, 2022. But we're just guessing. We don't know.
Mm-hmm.
So, we're anxious and we're excited and we're hoping that happens. And, schools across the country, have given flu shots, have given other vaccines for years. And, I anticipate as a trusted community a location that will happen, that schools will be participating in mass vaccines for students in the future. So, Sarah, did you want to add something else?
So, no, that's great, Liz. I really appreciate your clinical expertise and that perspective. And, it's being patient, right, to wait and see when we're able to get the vaccine accessible to most of the school age population. I did just want to hit on the question Audra also brought up about how will that then influence guidance for the fall. And so that also is one of our $1 million questions. We are already thinking about what guidance for the fall might look like. And so we are going to be taking into account vaccination rates. We work with some brilliant people who can model the impact of vaccine on transmission rates and what point that really helps. The challenge here, of course, is by and large, our school age kids right now are not eligible for the vaccine. And so we have to be thinking about continued mitigation strategies into the fall.
Awesome. Thank you so much. We ran out of time. We still have some lingering questions, so I might be following up via email that we can maybe address and upload to the handouts for those questions I wasn't able to get to. But thank you so much, Sarah and Liz. I so appreciate you sharing your expertise with us. Thank you to everyone listening in live that were asking really great questions. If you haven't already checked out the handouts tab, NASN has a resource list, and I'll be adding things to that resource list next week to add to your digital backpack. And don't forget to connect with us on social media using the hashtag #ShapeVirtual. So thank you so much again, and enjoy the rest of your day.
Thanks, Audra.
Thanks, everyone. Thank you, Audra.